Yo guys, what's up? So we're back with another video with good job here from M3.
How's it going, guys?
Today we'll be kind of talking about the topic, going off the topic we talked before, fat loss. But we're gonna be including resistance training and why that's essential for fat loss also compared to just doing cardio. So we're gonna set it up that way, like Gurjop is gonna drop some knowledge on you guys. I'll be asking him questions like, what is resistance training, stuff like that, and just go back and forth and have fun with it.
Absolutely.
So let's get right into it.
Get into it.
What is resistance training?
Resistance training, as simple as it is, it's literally adding resistance to making your muscles work.
Okay.
And it could be doing something as simple as push-up,
Okay.
body weight squat,
Okay.
or if you're in the gym, doing bicep curls, bench press.
Okay.
A bro workout, basically.
Bro workout. Okay,
Yeah.
sick. So like normal lifting that we normally,
Yeah.
we like doing, get that pump and stuff.
Exactly.
That's good for you.
Yeah.
That's not what we're doing, obviously, but that's another topic. Okay. So why would you do it when you're also trying to lose weight compared to just doing cardio?
Okay, so simply put is, as a sedentary individual, you're gonna have lower muscle mass.
Okay.
And with that, there's a lot of health concerns that do arise as we age.
Okay.
But as you increase muscle mass, what you're doing is you're increasing your body's potential to utilize energy at rest.
Oh, shit,
So
okay.
because muscles are gonna need energy to either repair,
Yeah.
grow, or just for regular function of day to day,
Yeah.
what will happen is as soon as you improve, increase movement, you're gonna end up tapping into those fat stores or
Okay.
glycogen stores
Awesome.
to utilize as energy.
That's what we want to do, right?
Absolutely.
Okay.
Because that leads into something where, like, when someone's overweight, you have obesity or diabetes,
Okay.
you have insulin resistance.
Yep.
And basically your body's unable to use the insulin, which is used for energy, and that leads to the diabetes and
Yeah.
other risks, right?
Yeah.
So because you have that increased muscle mass now, the insulin will actually, your muscles will have improved, you'll have overall improved insulin sensitivity.
Yeah,
So
due to
your-
the muscle mass, right?
and your muscles will utilize the energy.
Okay.
Reducing the amount of, so basically the number of, like if say when you're doing a blood glucose test.
Yeah.
So if your number is like 7, 8, that's
Yeah.
pretty high
Yeah.
at resting,
Yeah.
aside unless you had a meal.
Yeah.
So it would actually, the muscles will intake that glucose.
Okay,
So
okay.
it's not flowing around the blood.
Okay. So logically, like the food we're eating, if you're just sitting all day, we're technically not utilizing it. But if we lift weights and we build muscle, we're gonna be utilizing it better.
You become more efficient in a sense.
Become more efficient,
Yeah.
right? So that's what we want. So when
Exactly.
you're going through a fat loss phase, we want it to be more efficient, right? If
Yeah.
you have more muscle mass, you'll
Exactly.
technically be burning more calories and also just putting on muscle mass.
Mhm.
Who doesn't want muscle, right? Like
Exactly.
everyone
So-
trying to look like Hrithik Roshan here.
Along with that, so
Yeah.
I know a lot of people that are like, oh, I don't want to get too bulky, I don't want to get like this.
Yeah.
Resistance training doesn't mean you're getting bulky.
Yeah.
Right? You could do high rep ranges with lower weights, and
Yeah.
you just build. Your goal is to build lean muscle.
Yeah.
Why? Because now, if someone's trying to go under a fat loss program,
Yeah.
because you have that increased muscle mass now,
Yeah.
and you go into a calorie deficit, you're actually improving the level of your deficit.
Okay.
So let's say you had
Because you're expending more energy, right?
Exactly. So
Okay.
let's say you're doing 400 calories without resistance training now.
Yeah.
And because you have that increased muscle mass, you may be hypothetical numbers up to 800, 1,000 calories that are
shit,
being
okay.
burned
Yeah.
in general,
Yeah.
right?
Okay.
So you're basically your BMR, which is basal metabolic rate, is increased now.
Okay. See, that makes a lot of sense, right? And just for that same topic, I don't want to look bulky.
Yeah.
This is another topic, but just putting on muscle, that's just a long process. Like, just putting on actual muscle to look
It takes
bulky,
time.
it takes time, right? I've been lifting for so long, and look how good job makes me look, right? Like, I'm just saying, for example, right? Like, we lift every day almost, and it takes a long time to put on muscle, and we're so consistent with it, it still takes long. So I think that should be the last of your worries.
Yeah.
That you're gonna get too.
Eventually, your initial goal, if your goal is fat loss,
Yeah.
your goal should be to focus on how to improve your overall health.
Okay.
Right? How to improve efficiency. Because when it comes to training, fat loss, and whatever, everyone has individual goals.
Yeah, 100%.
But when it comes to fat loss, you shouldn't be worried, oh, I don't want to do this. Why? Because you might be inhibiting something that actually might work for you.
100%,
Right? So don't go in with tunnel vision.
Yeah.
Keep a wide perspective.
Open-minded.
Right?
Do everything, right? Like, diversify your portfolio if you're a business person, right? Kind of thing, right?
Exactly. You want a little bit of everything. I have a taste of a little thing, and then once you know what works for you, you perfect it.
Okay, so now we kind of have an understanding of what it is, why it's beneficial, and you better do it.
Yeah.
But how can we go back to the cardio, right? So
Okay.
do we include cardio in the resistance training
Okay,
sessions,
so-
like post or before? Or?
Absolutely. So aside from the fact that you want to build a muscle and do cardio,
Yeah.
the worst thing you could do to yourself is do it, not the worst, but what you don't want to do is do them together, because
Okay.
there's something called an interference effect that comes in play.
Oh shit.
And
okay.
basically what's happening is, because let's say you did a resistance training program, and then say you did a squat, bench, deadlift, right?
Yeah.
You're trying to build some strength.
Yeah.
And now you're trying to do some cardio to end it off because you think it'll help you with your fat loss.
Yep. Yep.
Sure, it's going to help increase calorie deficit,
Yeah.
but what's happening is you're actually reducing the potential for muscle gains. Because you're
Oh shit. We don't want that.
No,
Yeah.
because automatically as soon as you go into a cardio type of workout,
The energy system is different.
the energy system is different,
Okay.
and what's going to happen is your body's going to turn off the pathway where it focus on protein synthesis
Oh,
and
shit.
focus more on metabolic adaptations for the heart.
Oh shit.
Yeah.
Okay.
So
we
there's
don't want
that little trade-off.
Okay.
You can do them in the same day,
Yeah.
but have like a 6 to 3 hour gap.
Okay. What about something just like after you do your weightlifting sessions,
Yeah.
going for like a 15-minute treadmill walk?
Oh, yeah, you could-
Or like a normal walk.
Yeah, absolutely.
outside?
So the goal would be to keep your heart rate at a low rate.
Okay, okay.
And with that, what you're just doing is you're getting a walk in,
Low
which is
in- low intensity.
huge.
Yeah.
So if you did upper body, now you're getting your lower body.
Yeah.
Remember to train your legs, guys.
Yeah.
So with that,
Calves are okay. You don't have to. But
yeah. So just because you're doing that additional walk,
Yeah.
you're increasing your physical activity for the day.
Okay, awesome.
Right? Because another fun fact, almost 80+% of the Canadian population isn't
Yeah.
getting 150 minutes of exercise.
80%, yo, that's messed up.
150 minutes. That's
Okay.
literally 2.5 hours
Yeah, that's fucked up.
in 7 days.
Yeah, that's messed up.
So like,
Okay.
that's one thing we
So
got to
move. Yeah.
Movement. Get your
M3.
movement.
Yeah, that's what M3 is about, you know.
There you go. Yeah. So
Okay. Yeah.
it all plays hand in hand.
Okay.
So you want to do a little bit of everything,
Okay.
but don't mix them together.
So how would that look like in a span of a week, 7 days? Someone going through a fat loss phase?
Yeah.
Or just like a health phase, an
Yeah.
average person.
Mhm.
Resistance trains one day, cardio one day, that kind of thing.
Yeah, so you can actually do that. But
Okay.
what you want to do is depending on what your training and program looks like,
Yeah.
I wouldn't recommend doing a high intensity or like a hardcore cardio day
Okay.
before, like say you had a heavy squat coming or you're going in
Yeah.
for a leg day. You don't want to
Yeah.
go into a sense where you're hurting yourself
Okay.
or doing overuse repetitive
Okay.
stress workouts.
You might be sore and
Exactly.
and
So
okay.
let's say you did legs on Monday. You do
Yeah.
not want to go and do Stairmaster on Tuesday.
Yeah.
Why? You're just hurting yourself.
Yeah.
But let's say you did chest on Monday.
Yeah.
And Tuesday you want to do some type of cardio based where your weight bearing cardio.
Yeah.
Go on the treadmill, Stairmaster, go for a run, whatever it may be.
Okay. Low intensity.
Absolutely.
Okay.
Low intensity because you want to stay in that kind of a
Yeah.
fat burning zone.
Fat burning zone, yeah.
But there's no harm in doing higher intensity.
Okay.
But you don't want to do it if you're sore.
Okay.
Right? As a beginner, because you're going to be really sore because you haven't moved your muscles or worked them,
Yeah.
it's better to pay attention to your symptoms and focus on making that behavior changes.
Split them up. Okay.
Yeah.
So like, could something look like, whatever, upper body day on a Monday?
Yeah.
And then doing like a lower body cardio stuff on Tuesday?
Yeah, absolutely. So
and then
what you-
rest
yeah,
Wednesday.
so it's like, let's say you're training 5 days a week.
Yeah.
You could do, out of those 3 days, you can do some type of resistance training.
Okay.
And other 2 days, some type of cardio. Or you
Okay.
can flip that.
Yeah.
Or you can even do 1 day where you're only doing resistance training,
Yeah.
and then the other 3 days you're doing cardio. Or
Okay.
some sort of cardio,
Some
right?
sort. Okay.
So, because you don't want to limit your potential to I'm only going to do cardio workouts, or I'm
Yeah.
only going to do resistance training. You want a little bit of everything.
Okay.
Right?
Perfect. Yeah. So like, for fat loss purposes, make sure you do everything. It's not just about cardio.
Mhm.
I've seen because like, one thing that happens personally, just from my experience, every time I've done just cardio for weight loss,
Mhm.
I've gotten skinny. I don't. My muscle doesn't stay. I
Yeah.
lose kind of some of my muscle. So make sure you do resistance training as a part of your weight loss journey.
Yeah.
You'll just feel better. You look better. You can take more selfies if you want. But like, I'm saying, like, you'll have
Yeah.
more fun with it. It'll
Absolutely.
change up things. And yeah, it's just overall beneficial for your health, right?
Yeah, so like adding on to what you said, like how you feel skinnier.
Yeah.
So when we are doing weight loss, a lot of people fall into this idea of doing extreme diets
Yeah.
are better for you and they get you the results. Sure, you lost that weight.
Yeah.
But now what's happening is you potentially lost some muscle too.
Yeah.
And if you lose
Gone through
muscle,
that.
you're literally digging yourself a hole because
Yeah.
you're losing muscle strength.
Yeah.
And then as we age,
Yeah.
all these things will come back to you.
Yeah.
So the best thing to do is introduce some muscle, like muscle strengthening, like
Gain
right?
some muscle,
You
yeah.
gotta put on some strength, right?
Okay.
Because let's say you get 65, your foot fell down, and now
Yeah.
you don't have that strength to get up, or you're actually putting yourself at risk for getting hurt.
Yeah.
Right?
And
So
possibly insulin resistance, right? If you don't have
diabetes,
enough muscle.
metabolic syndrome, like there's
Yeah.
a lot of things that arise
Yeah. Yeah.
from
Not
having
having
low
enough.
muscle mass and low
Okay.
physical activity, right?
Okay.
So don't focus on just getting that slim build.
Yeah.
Focus on just overall improving your lifestyle
Yeah.
and health.
Awesome,
right?
awesome. And yeah, lastly, I just want to add on to that is just add cardio, add weightlifting, but do what's fun also, right? So
Yeah.
like you're not gonna stick to it if you don't have fun doing it.
Mhm.
So some people, like for me, for example, I love lifting weights. I have fun doing that. So I gotta actually add other stuff too. But I like lifting. That's why I stay consistent with it.
Mhm.
If you like doing boxing or something,
Yeah, so there
know,
you go. Like
have
there's
fun with it.
multiple modes of cardio, right?
Yeah.
You don't have to just do in the gym. I'm doing treadmill. You can go for a
Yeah,
bike ride. You can go for
exactly.
even going for hikes, right?
Yeah.
It's some type of movement, and
Yeah.
you're actually working your body, right?
100%.
Which is huge.
Yeah.
Right.
Okay.
So you
Yeah.
got to get your gains, get
Yeah,
your growth.
Exactly. Yeah. So exactly. Resistance training, cardio, both are good for fat loss. And keyword there, fat loss. We're not just doing weight loss, right?
Yeah.
So fat loss, like we just discussed, we're gonna lose fat. We're not trying to lose muscle here, you know. So
Exactly.
do your resistance training, lift some weights, get a pump, take some selfies.
Be patient and be consistent. You'll get your results.
Yeah, that's it. Hope
100%.
this helped, and let us know if you guys want to see other
Yeah.
videos,
If
right?
you have any more questions, feel free to ask. Cheers.
All right. See ya. Bye bye.
I gotta see the button.